Complacency. If you're complacent, you may be content with being overweight, out of shape, or even unsafe. But if you're complacent about a minor hernia, you may end up causing your body even more harm. What if we told you the organs in your abdomen can actually protrude through your abdominal wall? That can lead to strangulation of your intestines. Ouch!
Complacency. Sometimes it's just fun, but in other situations it can be dangerous. In fact, a lot of people, for instance, come into the ER because they're complacent with their symptoms. They say, oh, I'll wait it out. And they wait until it becomes a serious health threat. Then it's too late. So stop being complacent, because when it comes to things like hernias, there's actually a new surgery. It's changing the lives of some people with severe chronic hernias.
The procedure we'll be doing today, we call a BARS procedure, which stands for bony anchored reinforcement. It's a means to reconstruct an abdominal wall, typically in someone that has a large abdominal hernia.
So now we're coming up on the hernia sac, which is a flimsy layer that's around the actual intestines that have come through the hole.
This surgery is very new. We anchor our hernia repair to bone, so it strengthens the repair. But what is more important to us is that it redirects the weight of the contents of the abdomen into the pelvis like a bucket. We go into the abdominal wall where the hole or hernia is, fix the hole. We will attach a very large patch over the hole and then attach that hole to the bone, and then we will close the skin again.
This is the drill we use to drill a hole in the bone, and I'm going to drill the hole and Dr. Patel is going to put in the anchor. The surgery took an hour and a half to 2 hours. Patient did very well. Everything went as planned.
That was plastic and reconstructive surgeon Dr. Andrew Elkwood. He's here to tell us more. Thanks for joining us. And let's just first clarify what a hernia is for those that don't understand it.
Really what it is just a rent or a weakness in a certain part of your body. You can get hernias in different places, and you have tissue that moves from the spot it's supposed to be to a spot it's not supposed to be. So it's just...
It's like if in your abdominal cavity, if you have these layers of muscle here, and it usually holds everything in, but if somehow those layers kind of separate, you can see here, you know, there can be holes there.
Abdominal hernias.
Thing will come right through.
Epigastric hernias, tons of hernias, and we have the hernia expert, Dr. Elkwood, and you have a new procedure you want to share with us.
Yes, we have a procedure that we developed called the BARS procedure. This type of surgery is for patients that have recurrent hernias, multiple operations, not your typical run-of-the-mill. And it does two things. Firstly, that patch is sewn into the bone. It's attached to the bone itself, so it's very, very difficult for it to tear away. But what it does that's more important is it redirects the weight of the intestines or whatever's pushing through that hernia into the pelvis. The pelvis is kind of like a bucket. It's designed to hold the weight of the abdomen. And in a bad hernia that keeps coming back, that weight is not in the right place.
So this is a new, unique option for people who've really struggled with traditional hernia surgeries, these big ventral hernias.
They keep coming back. I mean, we've used mesh and every, but the point is how Dr. Elkwood is fixating to bone. You know that bone's not going to give. Changing the shape of the abdominal contents, they're not going to protrude anymore.
People need to understand these are life-threatening problems. If a hernia gets stuck, it can be deadly.
And we mentioned that in the tape piece. If it becomes strangulated, that means it's not getting proper blood flow. It becomes a true medical emergency. If a hernia is strangulated for hours and hours on end, your gut dies. And then you're dealing with an emergency surgery. You may have a super infection. I mean, really scary stuff. That's why if you have a hernia and suddenly it becomes more painful, you need to go get it checked out right then and there. But this is all about preventing that from ever happening. And we also have someone sitting next to you. It's Shannon. And Shannon had this hernia surgery. How are you doing?
I'm doing great today, thanks. I had a hernia. I was like 9 months pregnant. It was really, really horrible. I went to 3 surgeons in my area, all who refused to operate. They wouldn't help me. So what I finally did was I went to my OB's office in tears and begged her, please find somebody that can help me. I can't live like this anymore. And she then sent me to Dr. Elkwood, and he did the BARS procedure, and he saved my life, and I'm great today, no problem.
You had other abdominal procedures before?
I had 3 C-sections in about 3.5 years. So
and that's pretty typical because with the C-section, it can weaken that those layers that keep everything in.
And that's exactly what happened.
Now you're nice and flat.
Well, we're so glad you could both be here. Thank you, Dr. Elkwood. Shannon, great to hear you're doing well.